for North Coast.
Honourable Speaker, for people in Fort St. John, it's even harder to find a family doctor. Last year, 7 doctors announced they would close their family practices. There were already 18,000 people without family doctors. Now there are 24,000 without. The government has told people in Fort St. John that their region is important, but they have done nothing to ensure important services are there. Like everyone else in this province, people in Fort St. John are paying for this government's hikes in medical services tax, and they're getting less. Madam Speaker, why is this government ignoring the crisis care being faced by the people of Fort St. John?
Minister of Health.
Thank you, Madam Speaker. Well, Madam Speaker, first of all, it was this government that built a $350 million hospital in Fort St. John. We recognize, Madam Speaker, that it is a challenge in some parts of the province to attract the healthcare professionals needed. And I want to thank and recognize the member from North Peace for his efforts, working with the community, with the Mayor of Fort St. John, with the Divisions of Family Practice, with Northern Health. The community has wrapped themselves around this challenge of attracting physicians and other healthcare professionals to their community. They've made great strides with a walk-in clinic and a non-attached clinic. Madam Speaker, there are more doctors that are set to come to Fort St. John this year, and we've created 3 nurse practitioner spaces to help with that challenge as well. There's a lot of good work being done in Fort St. John.
Thank you, Minister. Recognizing the member for North Coast on a supplemental.
Thank you, Honourable Speaker. I'd like to remind the minister that the fancy, expensive hospital he speaks about in Fort St. John is filled with seniors that should be in a long-term care facility, not a hospital. Honourable Speaker, Lee Taylor lives in Fort St. John. He is a senior with COPD, emphysema, and lung cancer. He is on oxygen and he has no doctor. It takes Lee 5 to 6 weeks to even get into a clinic just for a simple medication change. If he wants to see one sooner, he has to call an ambulance. Does the minister agree that the situation in Fort St. John needs to be addressed now and make sure people like Lee Taylor have a doctor?
Minister of Health.
Thank you, Madam Speaker. Thank you, Madam Speaker. I wouldn't characterize the hospital in Fort St. John as fancy. Madam Speaker, it is state-of-the-art, modern hospital to serve that community. And there are people in Fort St. John working very diligently to address the challenge of attracting healthcare professionals to that community. A lot of work is in fact going on, and if the member would like to travel to Fort St. John and meet with the Mayor and the community members that have been so active making sure that this problem is addressed, she would learn that. Madam Speaker, rural healthcare is a challenge in every jurisdiction across Canada. British Columbia has more rural physicians per capita than any other province. We're working hard to make sure that communities that need those healthcare professionals get those healthcare professionals.